Now we get to look at what is known as hemorrhagic arthritis. Hemorrhagic arthritis. So for hemorrhagic arthritis, there's like joint disorder and is backing up with a lot of bleedings. So hemorrhagic arthritis is known as a joint disorder and is caused by what? Bleedings into the joint space. So hemarthrosis leads to this. So it leads to accumulation of blood, leads to pain, swelling, stiffness, progressive joint damage. Okay. So causes could be due to hemophilia. So repeated spontaneous bleedings into the joint, especially the knees, the ankles, the elbows, leads to chronic synovitis and joint deformities. Could be due to trauma, so those direct injury could cause bleedings. Could be because the person has been using anticoagulant drugs. So warfarin, heparin, all those drugs that will prevent uh, your blood from clotting. So they could prevent your blood from clotting so much that can tilt it into, bleeding too much. We also have blood dyscrasias, leukemia, thrombocytopenia, other clotting abnormalities. Sometimes it's after a surgery. So clinical features is your joints are swelling, they are painful, they are warmed, the movement is not there again, you know, lead to cartilage destruction, deformity, you know. You have it mostly in the ankles, in the elbows, in the knees. So diagnosis is clinical history, so bleeding disorder, trauma and anticoagulant use, joint aspiration. You try to see that there's blood in the joint. Try to confirm that. Then what next? You do imagings where you see that what the synovium is what enlarged or you say hypertrophied. Then you also do coagulation factors where you try to see that you know the person's platelet levels are down and all of that. Basically try to identify why the person is bleeding so much. So management is what? Rest, compression, ice. You try to replace the blood clotting factors that are actually what's lacking, you know. Anticoagulant adjustment if the person is taking drugs that are preventing blood from um, clotting. All right. So that's what we have for hemorrhagic arthritis.